Good afternoon. Annette Rodriguez, Health Director, and we're going to start with the Nueces County statistics. So the first slide that you see up is the number of cases that we've had since the inception of COVID-19 in March of 2020. And so you see very clearly the different waves here. The first original wave, the second winter wave, the third Delta wave, and then finally the Omicron wave. And now you see the numbers coming down, for a total of 96,610 COVID cases in Nueces County since March of 2020. Hopefully we will not reach that 100,000 number of cases here. Next slide. The weekly cases are very nicely coming down, as you can very clearly see here. You remember the week of Christmas, December couple of days after, we jumped from 300 cases of COVID-19 to 1,373. At our peak, we were almost at 7,000 COVID-19 cases in January, and now we're coming very nicely down. So that's good news for everybody. Next slide. This slide is a little different because we added in the deaths on top of the cases. So you see the original, you see the winter peak, you see the Delta peak, and you see the Omicron peak in blue. But what you also see in orange or bright yellow, you see the number of deaths as they relate to the cases. So what's really interesting for us here to look at is in the original, you see how close the number of deaths were to the number of cases. And what you see from Omicron is the number of cases is really high, but the number of deaths is low in comparison to that wave. So that's really good news, and that's also indication that the vaccine is working and doing what it's supposed to be doing to help all of us. Next slide. This is the age breakdown for cases through this year from January to the middle of February. And so you see a total of 26,391 COVID-19 cases just in 2022. And the majority of them are still in the pediatric population. Those 0 to 19 years of age, 7,377 that were COVID positive. The next slide shows the hospitalizations and the ICU cases. And now you can finally see that normal bell curve, if you will. And so you see as cases were rising toward the middle of the graph and as cases are starting to come down. We've circled the peak of the hospitalizations for this Omicron, and it's 242 at the peak. Compared to during the Delta wave, the peak was at 444 hospitalizations at that time. A lot more people didn't have their boosters yet during the Delta wave, so we were a lot more fortunate with the Omicron and with the severity being less than Delta. The next slide shows the positivity rate, and we've talked a lot about the positivity rate. That's how many people that come in to get tested at our drive-through compared to the total number that come through. So how many are positive compared to the total amount of people that are tested. So back in December before Christmas, the positivity rate was very low. It was 10.5%. And then in the beginning of January, it jumped up to 43%. In the middle of January, it was 55%, and that was about the time that we were having our peak number of cases. And then February 1st, it started dropping down to 45%. And just recently, February the 14th, it's down to 29%. So 29% of the people that come through our drive-through become positive with COVID-19. So that's definitely a good indication that things are starting to look better. If you look at the bottom graph, that tells you that how many people actually went through our drive-through. If you look back in 2020, in just 1 month, in July, we had 2,346 people that went through our drive-through to get tested for COVID-19. And then if you look at a year later, in August of 2021, we had 6,683 people that went through the health district drive-through. And then if you look at last month in January of 2022, we had 14,163 people that actually went through our drive-through to get tested. So you can see that there was definitely something that was going on here. And we all know the name of it is Omicron. Next slide. Again, for pediatric COVID-19 symptoms, we're still seeing the highest majority of people that are getting COVID currently are in our peds. And so we want to remind parents, if you see your children are having trouble breathing, if they're having dehydration, their skin doesn't bounce back like it should, a persistent pain or chest pressure that they're complaining about, a loss of taste or smell, changes in the skin, discoloration on the hands, on the feet, a sore throat, they're complaining of a sore throat, nausea, vomiting, belly pain, diarrhea, chills. The main symptoms that we're seeing with Omicron are the cough, the fever, and the sore throat, but please monitor them closely. We did notice that our Driscoll Children's Hospital numbers doubled from a few days ago, so we're just watching it very closely still. We also didn't have any deaths today, which is really great news for us, but we know that deaths lag from infections, and yesterday we had 10 deaths. So, those were 10 individuals that lost their lives when this could be prevented. It's now considered, COVID-19 is considered a preventable illness, and so by getting vaccinated, you can prevent death. Next slide. These are vaccine breakthrough cases in Nueces County, and so for the total number of breakthrough cases were 14,332, and again, a breakthrough case is that somebody was fully vaccinated, either with the 2 mRNA or with the 1 J&J. It doesn't include the boosters for these individuals. So of those 14,000 cases, 9,282 of the breakthrough cases were just in this year alone. So the majority of the breakthrough cases were in 2022. The total hospitalized from everybody that's been vaccinated, and you're going to see well over 200,000 people have had doses of COVID-19, 404 have been hospitalized of that huge number. And the deaths, 128 have died from COVID-19. The next slide. If you look at this is a reinfection. So these are people that got infected with COVID-19 either very early on at the beginning in 2020 or later or more likely with Delta. That's where you see the Delta numbers. They got reinfected here, probably from the original. And now they're getting reinfected with the Omicron. You see these high number of cases here. So a total of 2,038 people had COVID once and then got reinfected with COVID a second time. So, and 1,680 of those 2,038 were identified from December of 2021 to the present. So the majority of the reinfections were from the Omicron variant. Next slide. This shows you the number of total vaccines administered here in Nueces County. So the health district has given over 206,749 vaccines, COVID vaccines, and we've given over 30,621 boosters. The total number of COVID vaccines in Nueces County, including the health districts and other providers, is 506,700. And the total number of boosters given, including the health districts, is 81,183. And these are a breakdown of the vaccines that were given. The majority of what we've given at the health district has been Moderna, because that's the majority of what we actually were receiving. Initially, the hospitals were getting Pfizer, and we were getting Moderna. Next slide. The vaccination rates, you'll see for Nueces County, we are making a difference. We are moving that needle. So we're at 56% for the entire Nueces County population. And we're trying to get really close to where our most vulnerable population, those 65 years and older, are at. They're at 81% fully vaccinated. That's a great number. We're glad that they're there. But we need to get everybody in between there from the 5 years of age and older up to that great percentage of 81. So this next slide is basically one of the new CDC guidelines that's just recently made a change. And the change is for those individuals that are immunocompromised. So if you're an immunocompromised, whether it's moderately immunocompromised or severely immunocompromised, some of those individuals are people that have recently had an organ transplant, or they're HIV positive, they're taking certain immunocompromising drugs. They've changed the booster, so now you don't have to wait 5 months after your second mRNA. You can get it in as early as 3 months after your primary series. So 3 months after your mRNA, you can now get your booster for those that are moderately to severely immunocompromised. And this effect just changed February the 11th. The next is just the regular series of vaccines that you're able to get. From 5 to 11, there still is no booster. If you're 5 to 11, you can only get the 2 vaccines. There's the 12 and older, that's the one that you are able to get the booster. If you're not immunocompromised, it's 5 months after your second mRNA. The same for 18 years and older. And then for J&J, it's the 1. And it's also a booster. CDC is also now recommending with the J&J that you consider getting the 2 mRNAs. So if you've had a J&J vaccine, you may want to speak with your physician about, even though you've gotten a second mRNA as a booster to your J&J, you may need an additional mRNA so that you can complete that series. Next slide. So this is the COVID-19 vaccine clinics that we currently run at the Health District. We're out at La Palmera Mall at the old Charming Charlie's. We're at the Greenwood Senior Center, and that's our one that opens up early at 8 a.m. We're at the former outlet malls at the Nike store. We're at the Hilltop Community Center in Annabelle. We're at the Nueces County Courthouse as well as here at City Hall. And we're in Port Aransas every Thursday through the first week of March from noon to 6 p.m. For the drive-through COVID vaccine clinics, there's a lot of people that still don't want to get down and get vaccinated with congregate settings. You can go through our drive-throughs. We are at the FIAS parking lot on SPID. We're also at the Goodwill store on Ayers on Tuesdays and Thursdays. And we're at the QSR Legacy, and that's on South Staples on Mondays and Thursdays from 11 to 6 p.m. Next slide. For schools, we're at Gibson, Houston Elementary, Castores, and Los Encinos the rest of this week. And so far, with all of the elementaries and high schools that we've been at for the last couple of months, we've vaccinated over 5,000 students and parents. And so the vaccination clinics at the schools are going very well. Next slide. So for the testing, we're still at the Old Memorial Hospital on Monday and Thursdays from 9 to 5 p.m. And Amistad is also still testing on Tuesdays and Thursdays from 7:30 in the morning to 8:30, but it is by appointment. So you do need to make that appointment. And the last slide is basically the new CDC guidelines, and I've already talked to you about those individuals that are immunocompromised not having to wait 5 months to get a booster. They can now get it as early as 3 months after their second vaccine. And also that if you've had monoclonals recently, even if it's convalescent plasma or if it's monoclonals like the Regencov or the Sotrovimab, you do not have to wait the 90 days anymore. CDC just changed those guidelines as well, saying that as soon as you're recovered, you can get your COVID-19 vaccine. So that's really, good for those individuals that have gotten their monoclonals. I will now turn it over to Dr. Bird, but Gabby's going to do the translation first, and then we'll end with Dr. Bird. Thank you.
En el mes de febrero se han reportado a la fecha 3.366 casos positivos por COVID. Esta cifra está declinando en comparación con la segunda semana de enero, en donde se reportaron cerca de 7,000 casos. La variante Omicron ha sido la variante con el mayor número de casos comparado con el virus original y las variantes Delta, así como las cifras pico reportadas durante el invierno pasado. El mayor número de casos positivos continúa siendo en el grupo de personas de edades entre los 0 a los 19 años. El día de hoy se reportan 152 hospitalizaciones, 36 de estas en la unidad de cuidados intensivos. 242 casos se reportaron a principios de febrero. La tasa de positividad de las pruebas para la detección del virus ha bajado drásticamente. Durante el 14 de febrero, la tasa de positividad fue del 29%, la más baja reportada desde hace un año. El pasado mes de enero se llevaron a cabo 14.163 pruebas de detección. Recuerde los síntomas que pueden presentar los menores a este virus. Algunos pueden tener síntomas, otros pueden ser asintomáticos. Entre estos síntomas se encuentran los problemas para respirar, deshidratación, presión en el pecho, falta de olor o sabor, dolor de garganta, náusea, vómito o diarrea, entre otros síntomas. Las reinfecciones en personas se reportó el pico más alto del 2.031 personas entre el mes de enero y febrero de este año. El total de vacunas administradas entre el Distrito de Salud y doctores privados ha sido hasta la fecha de 206.749 vacunas. Se estima que en el condado de Nueces hasta el 56.2% de la población elegible está completamente vacunada. Entre las nuevas reglas de los CDC para las personas cuyo sistema inmunológico está débil, ya no hace falta esperar 5 meses para obtener la vacuna de refuerzo. Ahora lo puede hacer después de 3 meses de recibir sus 2 dosis originales. También sugieren obtener una vacuna ARNM como refuerzo, aunque haya recibido la doble dosis primaria de Johnson & Johnson. Las clínicas de vacunación continúan ofreciéndose para todos los residentes elegibles en los lugares permanentes y en las escuelas de los encinos durante esta semana. La toma de pruebas continúa también ofreciéndose los lunes y jueves de 9 a 5 en el antiguo Hospital Memorial.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to give you this week's COVID-19 pandemic report on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team. We have 2 objectives. One is to enable evidence-based decision-making on behalf of our local leaders, and the other one is to answer the questions and concerns you might have about COVID-19. So getting right into our model projections, we updated the model this past week to better fit the data, and you can see the Omicron curve here. The black data points are the actual number of new confirmed cases per day in the coastal bend throughout the Omicron curve and the Delta curve. The blue line is the new projection model, or the new model projection that we've made. You can see that the number of cases has come way down from the peak now, and hopefully that will continue. The model indicates that indeed it will. In terms of people going to the hospital, these are medical surgical beds and how many people are in those beds with COVID on each day. The hospitals call this the med-surg census. The data points are in black and the model projection is in blue. You can see that the people in the hospital has not declined nearly as much as the number of cases per day. And we're maybe almost about halfway down the curve right now, so there's still quite a bit of people with COVID in our hospitals, but we project that that's going to continue to decline for the foreseeable future should we not have any major changes. Same pattern is there for people in the ICU. Again, the data points here are the number of people that are in the ICU with COVID each day. Those are the black data points, and then the blue line is the best fit model projection through those data points. And again, we're about halfway down the curve, not quite, and we project that the number of people in the ICU with COVID will continue to decline into the future. Giving you a bit of a broader perspective of how many people have been in our ICUs over the majority of the pandemic, with all the way on the left being the peak, the first peak we really had in the summer of 2020. That's the original SARS-CoV-2 spike. Then we had the Alpha variant, and then we had the Delta variant, and now we're on the Omicron variant. You can see that we peaked out with the number of people in the ICU a little bit higher in this past Omicron curve than during the Alpha curve last winter, but not nearly as high of a strain as during the Delta wave or during the original wave that we experienced, and we're on our way down. The thing that's really important here is the ICU vacancy, and what we need to realize is that during the Omicron curve, we've just had less staffing in our hospitals than at other points in the pandemic. And so this leads to lower vacancy. So this graphic shows you how many beds that are staffed in our ICUs are available to receive new patients that need that intensive care. And that's been increasing recently now. We're all the way up to 8%, but it's still quite a low level. And it's been all the way up to 12% in the past week. But we're hoping that those numbers can continue to increase as the number of COVID patients in our ICUs decline. Lastly, with the number of fatalities, it looks like we're past the peak in terms of fatalities, and the model projection is that the number of fatalities should decline from here forward on the Omicron wave, should we continue on this same trajectory that we're on right now. So, in summary, cases, hospitalizations, and fatalities due to COVID are declining. 2, ICU vacancy is low, but it's increasing, so that's moving in the right direction for us now. And 3, we have some recommendations, and that's generally follow the guidelines of the local public health department as well as the CDC as we move forward. I've heard that maybe we won't be speaking next week, so this potentially could be the last presentation for at least 2 weeks, if not longer. And I recommend following the advice of these agencies. They have your best interests in mind, and nobody has better information on what's going to happen next in this pandemic than the CDC. So those are the types of authorities that I would look to moving forward. All right, we're going to go to a translation, and then we're going to wrap this up with Public Health Director Rodriguez. Thank you.
De acuerdo al último pronóstico, se estima que los reportes del virus sean casi nulos para el mes de marzo. Las hospitalizaciones por Omicron llegaron a su etapa pico durante el pasado mes de enero a los 250 casos, mientras que la variante Delta llegó a más de 400 en la etapa pico durante el pasado mes de agosto. Para la variante Omicron también se estima que las hospitalizaciones en la unidad de cuidados intensivos continuó declinando significativamente. Durante la etapa pico, los casos en la unidad de cuidados intensivos fue más alta comparada al invierno del 2021. Actualmente, del 8 al 12% de las camas de hospital están disponibles para pacientes nuevos. Según las proyecciones, los fallecimientos por la variante Omicron también están declinando y han sido mucho menos comparadas a la variante Delta, que llegó a su etapa pico durante los meses de agosto y septiembre pasados. Las recomendaciones para los residentes siguen siendo las mismas: tome sus precauciones sanitarias, utilice cubrebocas, lave sus manos seguido, desinfecte superficies tocadas frecuentemente y guarde su distancia. Evite ir a lugares con grandes aglomeraciones de gente. Si cree estar contagiado, hágase la prueba y siga las recomendaciones de su doctor para evitar contagiar a más personas y mejorar su salud.
Thank you, Gabby. So this will be the last briefing today, so it's going to conclude our weekly COVID-19 Omicron briefing. So thank you all for being here. We really appreciate it. You know that the Corpus Christi Nueces County Public Health District will continue to monitor the latest COVID-19 developments, and we will hold news briefings should the need arise. Today actually marks the 713th day since we actually started at the health district monitoring this pandemic. And residents can still find the latest COVID-19 information by visiting, of course, the cctexas.com/coronavirus website. They can also look at the social media channels, including Facebook at CityGov and Twitter at City of CC. And they can also always visit the Nueces County website at nuecesknows.com. So the briefings began in March of 2020 and respond to the COVID-19 pandemic. And since then, this is the 168 live broadcasts have aired since the beginning. So we've done this many, many times. And the speakers, as you all know, included the mayor as well as the county judge, as well as Dr. Bird and myself, and even our local health authority, Dr. Ramachandruni. So thank you to all of them. As always, stay safe. Stay aware of your surroundings. If you're in a congregate setting, put your mask on. And as always, stay informed. Thank y'all.